we've dealt with so far has been how to prevent scatter from being created. We know that no matter what we do, we're going to create some scatter radiation, right? Clark, could you hit that second button? We know that no matter what we do, we're going to create scatter radiation. So how badly that scatter is going to affect the image depends on tissue type, tissue thickness, to a lesser degree KVP, and also to a lesser degree how much we collimate. So Ariely asked a great question, and her question was, does filtration add to scatter? And the answer is yes. Not in as much as you're probably going to hear any kind of question on, not on my test and certainly not on the registry about it, but anything that pushes the brim spectrum towards a high energy side is going to give you a higher percentage of scatter penetrate through the patient. All right, so if you add filtration and increase your mass to compensate for that filtration, then you're going to have a higher percentage of scatter. So the answer to the question is yes, but it's not something that you really need to spend any time, worrying about. So the main things that we've talked about as far as scatter creation goes, again, are field size, tissue type, thickness of the tissue, and those sort of things, right? And KVP. So with grids, then, what we're doing is, what we're attempting to do is to clean up the scatter after it's created. So you got all the different types of interactions inside of the patient. You got penetration, you've got absorption, you've got scatter that becomes absorption, and you got scatter that penetrates through. The purpose for the grid is to absorb the wide angle scatter radiation. So it may or may not do anything for the Thomson classical scattering because it pretty much parallels your transmission, right? But it's low energy and it constitutes a very small portion of the X-ray beam, so it really doesn't matter all that much whether or not we do anything with it. We're going to talk about virtual grids here in a minute, and those might be better at absorbing those, or it doesn't really, it absorbs them, but it kind of excludes them from the processing. So we'll talk about that here in a minute. So what we're mainly going to focus on are physical grids. We're going to talk a little bit about air gap technique, and then we'll talk just a little bit about virtual grids as well. So what grids do, or what they are a set of lead strips that should stand parallel to the travel of X-ray beam, grid strips, all right? So that what we get then, if we were to be able to visualize the grid strips, they should appear very, very thin, okay? So the effectiveness of the grid, we'll talk about all the different measures of the effectiveness of the grid, but in as much as not wanting to be able to visualize a grid, we need those grid strips to be very, very thin. So if we have multiple grid strips, then wide angle scatter radiation that exits the patient's body and it's going off at a wide angle like that, it's just going to broadside one of these grid strips, it's going to absorb them. Now, is a grid strip also going to absorb some of your useful secondary radiation? Mm-hmm. The answer is yeah, it will. And if you have a high enough resolution monitor with the ability to magnify up, you can actually see the lead strips. Typically, you don't see them all that much because they're very, very thin. So the purpose for the grid is to clean up the remnant beam, remove as much of the scatter radiation as possible. And the construction is strips of lead or some sort of very radiopaque material with something that is less radiopaque in between them. So they're alternating strips of very radiopaque versus not so radiopaque. And I'm selecting that word not so radiopaque for a specific reason. We have a lot of different things that we're going to use for the interspace material. Some of those are radiopaque. So developed by Gustav Bucky, we talked about that the first part of last semester. It's designed to transmit the X-rays that are going on a straight path into the image receptor. So anything that scatters wide, it should be absorbed by the grid. Alright, so the things that make a grid effective, there's two different measures of grid effectiveness. One is grid ratio, and that's really your definitive measure of grid effectiveness. And that is defined by the height of the lead strip divided by the distance in between them, okay? So what you're gonna have a tendency to do is confuse the height of the strip divided by the thickness of the strip. It's the thickness of the interspace material, so it's the distance in between the lead strips. So the higher the grid ratio, meaning the taller those strips are and the more narrow that distance in between them is, the more scatter cleanup you're gonna have, the more effective the grid is. The more effective the grid is, the more potential contrast that you can add to the image. That's what we refer to as contrast improvement factor. So the most effective grids have a high ratio, meaning that they have a high, tall grid strip and a narrow distance in between them. The difficulty there is a couple of things. One is that, okay, so I grew up in a house that was built in the 50s, and they loved a long hallway in the 50s. Okay, so my mom and dad's house still stands there today, but at any rate, the hallway is probably 50 feet long. It's a long hallway that runs almost the entire length of the house. And long before they had Nerf guns, what we had were these guns that we'd get every Christmas, or whenever we had any kind of money. And you took these darts that had a suction cup on them, you crammed them down inside of this gun, right? And it would stick, and then whenever you pulled the button, it'd release a spring, and the dart would shoot at, Nerf gun speeds. So I had a brother, and we would start at different ends of the hallway, and whoever got hit first, we did try to advance on each other, and whoever got hit first lost, right? So my mom and dad's room was at one end of the hallway, our bedroom was at the other end of the hallway. In between there was a doorway to the kitchen, a doorway to what we refer to as a living room. It's that room in the house nobody ever used. A bathroom on the opposite side and a separate bedroom, and then there were bookcases. So we had a lot of cover, right? But if he was in our room and I was in mom and dad's room and we were shooting these single shot little, Nerf guns, it was harder to hit somebody. They were inherently inaccurate. It was harder to hit somebody at that 50-foot distance, right? As a matter of fact, you were probably more likely to hit a wall than anybody else. But by the time we squeezed together and we were shooting at each other from bathroom to bedroom, it was hard to miss. Okay? Now, so I go all that way to say this, that we can get to a point with our grid strips where they are so tall that and become so efficient that they absorb all the x-rays that might be at a wide angle scatter, maybe at a narrow angle scatter. It becomes a very efficient grid, okay? So any kind of deviation away from parallel to those grid strips is going to be absorbed, and you're going to see grid lines, and it becomes, kind of obvious. So the effectiveness of the grid is in part dependent on how tall that thing is. Also, the closer we pack them together, then the higher the grid ratio, and also the more effective it becomes. So the second measure of grid effectiveness is what we refer to as grid frequency. And grid frequency, grid ratio is a little bit more complicated. It's going to be measured like 5 to 1, 16 to 1. That would be the height of the grid strip is 5 millimeters, 1 millimeter in between, something like that. 16 to 1, excuse me, 16 to 1 would be much more effective. It would be more efficient cleaning up the scatter radiation. So the higher this first number, excuse me, the more effective the grid the better cleanup you have, the better the contrast improvement factor, okay? So, 5 to 1, 16 to 1, everything in between. And we'll talk about the significance of those here in just a minute. So grid ratio, height of the grid strip divided by the distance in between. Height over distance gives you grid ratio. So grid frequency then is less complicated, and that's just how often you're gonna have a lead strip. Okay, so I'm gonna pull this one up and we're gonna do just a little bit of math. Yeah, there's math for this. Not a ton of math, but there is some math. All right, so let's say we have a grid and I'll kind of draw it out. So we've got a grid and we've got these grid strips. This is a little bit of a warped grid with floating grid strips. So let's say that the height of the grid strips is 8 millimeters and the distance in between, let's say this is not realistic, but the distance in between them is maybe 1 millimeter. Okay, so what would our grid ratio be? It'd be 8 to 1. It'd be 8 over 1. 8 over 1 equals 8 to 1 grid. Okay, so in this case, what we might have is a frequency of one grid strip every, I don't know, 1 per millimeter. Okay, so we got 8 to 1 grid. What if we were to take that same grid and we were to double the number of strips or the number of grid strips? Let's say we still have 1 millimeter in between, but I've got twice as many grid strips per millimeter. What would my grid ratio now be? If it was 8 to 1 before, times 2, we doubled the number of grid strips. 16 to 1, right, 16 to 1. 16 to 1. So, again, what we've got is thinner hallways, so to speak, so that the scatter radiation has a harder time getting through.
Wait, would that be ratio? The
Grid
16 to 1?
Yeah.
Well, but it's the same height.
Yeah, yeah, I didn't change the height. All I did was add more grid strips, so
Right.
I
Why?
doubled. Pardon?
So is it, sorry, my brain, it might be limited by what I'm seeing. Did it get wider or just more compact?
No, just more compact.
Okay.
Yeah, yeah. So we just, if you're familiar with what spackle is, spackle fills the cracks in a wall,
Okay,
you know. Yeah. So we spackled in the interspace with more lead strips. So I'll put more lead into the grid, same size grid. I just decreased the distance in between. Well, that's probably what's throwing you off.
Yeah.
Decrease the distance in between, and I doubled the amount of lead. So if then, let's say, if I maintained, let's say, and let's don't do that. Okay, so let's say we got 16, and now we have a half
Mm-hmm.
in between. What would that be? I probably should have started off with a smaller number. It'd be 16, you're never gonna see a grid like this, but 16 divided by 0.5 would be, what would that be,
Wait,
32 to 1?
32.
32 to 1? Yeah, so, you don't have any primary beam left after this, but, at any rate, the more lead that you have in your grid, the higher the grid ratio, the better the cleanup. Now, I started off this way to describe grid frequency. So, if I were to go back to this original and double the number of grid strips, but I cut this in half, like that,
It'd still be 8 to 1.
this could be 8 to 1, right? So now I've got 6, no. What am I doing wrong here? Where's my math That will cut the height, they're very good, yeah, they cut the height in half, so instead of 8, it'd be 4, divided by 0.5, and that's gonna give us, we're back to 8 to 1. Okay, so what changed between those two? We still have 8 to 1 grid, so theoretically the effectiveness, that level of effectiveness remains the same. So the amount of cleanup should remain the same. Contrast improvement factor should remain the same as well. But what changed?
You just kind of replace the height of your grid with how many strips you have.
Right, doubled the number of strips
Reduce the height.
and reduce the height, right? So, when you do something very often, right, what do we refer to that as? There's different components of, or descriptors of electromagnetic radiation. You have wavelength and frequency, right? So this describes grid frequency. Grid ratio is this. Grid frequency is a measure of grid effectiveness, but it's not as good a measure as what grid ratio is. Okay, so grid frequency just tells you how many grid strips you're gonna have in a given distance. So when we doubled our number of grid strips and we cut it, the height down, then we wound up with the same grid ratio, but with a higher grid frequency. Okay, so you're gonna run into some questions on grid frequency and where grid frequency played a part in the evolution from screens and films to especially CR imaging. Alright, so if you take a picture of your computer screen, you see a picture on your computer screen, you take a picture of that picture on your phone. What does the picture on your phone look like? You got lines, right. That's what you refer to as an aliasing artifact. A-I-L-A-I-S-I-N-G, I think. Aliasing artifact, also referred to as a Moray artifact. M-O-R-R-I-E with a on the end of it. Okay, so Moray artifact. And we had a problem with Moray artifact whenever we changed from screens and films to CR. So the way the CR image is created is we make an exposure on an image receptor, and then it kind of has to be scanned by laser light. And the grid frequency that we were using was too similar to that scan pattern, and what we wound up with is that aliasing artifact or Moray artifact. Okay, and the reason that you get that on your phone is because the resolution on your computer and the resolution on your phone are too similar, and you get the same thing. All right, so what they did then is they took the grids and they increased the grid frequency, maintained the same grid ratio by decreasing the height of the grid and doubling the number of grid strips in between. Okay, so now we have this similarity between that scan pattern. They're not so much alike, and the aliasing artifact goes away. Okay, so grid frequency, how many lines you have per millimeter. Grid ratio is the ratio of the height of grid strips divided by the distance in between them. Both are measures of grid effectiveness, but grid ratio is much more so. Okay?
So like on the test, how would you ask about grid frequency? Would it be more math-based questions or?
No, it'd just be, what measure of grid effectiveness would be described by the number of strips within a millimeter.
Grid frequency.
Yeah, it'd just be a description.
Okay.
So
So-
you're not gonna ask us to do that, like go change the grid frequency and ask us to figure out what the new ratio would be?
No. It's just gonna be, if you have a grid ratio, it's just gonna be, I'll probably give you 3 different things. The height of the grid strip, the thickness of the grid strip, and the distance in between. So you're gonna have to remember not to go with the thickness of the grid strip, the distance in between. Okay? so the interspace material can be a lot of different things, and there are benefits to each one of them. So, they may be almost completely radiolucent, meaning that they don't absorb really appreciably any X-rays at all, like carbon fiber or something like that. They may be plastic. They used to use, a long time ago, they used to use paper. The problem is that we deal with body fluids. So if you have a crack in your grid and some body fluid gets down inside, you know what happens if you drop a book in a mud puddle, right? Or in a water puddle. The pages are never the same again, right? So the problem with paper is it absorbs the water, and the hydrostatic pressure of absorbing that water is going to warp your grid strips, so it becomes obsolete. All right, so sometimes we'll use aluminum, and the benefit to aluminum is that the atomic number of aluminum and atomic number of lead, even though it's quite a bit different, lead being much higher atomic number, it's going to absorb more X-rays. It's not as the grid strips become less obvious than if you were to use something like paper or plastic or carbon fiber, where X-rays go straight through. Okay. In addition to that, they're probably going to absorb those low energy Thomson narrow angle scatter photons, so that you get a little bit better cleanup, plus the grid lines aren't going to be quite so obvious. So it may help the grid lines to not be so obvious. Unfortunately, they come with a higher dose because it's going to absorb more of the X-ray, the remnant beam. Doesn't absorb water. It's easier to work with, but you can also use plastic fiber as well. So our technical compensation for grid use is going to be mass. And if you look at the bucket factors on table 22-2 on page 302, this bears a little bit of explanation. Alright, so what are our rules for grid use? 70 kVp or above. That's number one. 10 centimeters or above, so shoulder and knee size, so forth. We need a grid most of the time. I'll talk about that here in a bit. So if you look at that, what that table is referring to, or what it is giving you, is technical compensation for the use of a grid. All right, so if you're not using a grid, then your Bucky factor, bless you, is a mathematical compensation. It tells you how much more mass to use for that particular grid. So if we have no grid, 70 kVp, your Bucky factor is 1, you have no grid, right? But if you go to a 5-to-1 grid, then if you notice on that chart, what does it say under 70 kVp? 2. So what that means is you would have to use twice as much mass. Okay, so you double your mass. Just the presence of a grid in the X-ray beam, doesn't really change your output from the X-ray tube. But if you're phototiming, or if you're not phototiming, you're going to have to adjust your technique to make sure that you compensate for the use of that grid. So 5-to-1 grid at 70 kVp, your Bucky factor is 2. 8-to-1 grid, what is it? 3, right? So we're talking about an 8-to-1 grid versus a 5-to-1 grid. What did we just say the 8-to-1 grid is? What can we say about the 8-to-1 grid versus a 5-to-1 grid? It's more efficient, right? It removes more scatter radiation. Since it removes scatter, going into your computer algorithm to create your image, if we remove those photons, then we have to increase something. So we're going to have to increase our mass, right? So at 12-to-1 is 12-to-1 is 3.5. At 16-to-1 is 4. All right, so that's 70 kVp. If we increase our kVp, what happens to the penetration to the patient?
Goes up.
It goes up, right? So it's penetration, straight penetration, but it's also penetration of scattered photons, right? So now look at that same chart, and if you look at 90 kVp, what's your Bucky factor for a 5-to-1 grid?
2.5.
2.5. Why is that?
Because you create more scatter.
You create more scatter, so it absorbs more scatter, so you have to replace it, and you're gonna replace that with 2.5 times more mass. And if you go, continue to go at 120 kVp, your 5 to 1 is gonna be 3. Okay, so on the test, you're gonna have to calculate, when you go from, let's say, no grid to presence of a grid. You may have a word problem that says that maybe you shot a chest x-ray, a decubitus chest x-ray, the patient had pleural effusion. Pleural effusion will really screw up an x-ray, create scatter radiation where we should not have scatter radiation. So we go to do a pleural effusion, decubitus chest x-ray, you add a grid. Let's say you add an 8 to 1 grid, you had the perfect technique at, let's say, 85 kVp at 3 mass. Okay? You use an 8 to 1 grid. What are you gonna have to do?
You're gonna have to up your kVp, or up your mass.
Increase your mass, right? On the test, I'm gonna give you the Bucky factor, okay? It's gonna be on the back, I think it's on the back page, it's somewhere on the test. So when you get to those, compensation for addition of grid or change in grid ratio, then, just look for that in the test. I don't want you to have to memorize each one of those, especially for each individual kVp level. So the takeaway from the table 22.2 is that we have to compensate, right? We don't want to compensate with kVp, because if we compensate with kVp, then it's just going to compound the issue. The grid's there to absorb scatter radiation, increase kVp, you're going to increase penetrated scatter radiation. It becomes more effective, and you're going to have to increase your mass more anyway, right? So your compensation is always going to be mass. The other things are that as the kVp goes up, as the grid ratio goes up, what's going to happen with patient dose because of the use of grid? It goes up dramatically, as a matter of fact. So you're going to have questions that will ask you things like pediatric hospitals. What grid ratio would be best in a pediatric hospital? Low. Why?
Because it's less dose.
Less dose in developing tissues, right? So if you go to work in a pediatric hospital, you might not be able to find a grid ratio above 8 to 1. As a matter of fact, most of them may be 5 to 1. Okay, so 5 to 1 grid ratio would be best. Also, though, sometimes, okay, so your general rules of thumb are 10 centimeters or above, 70 kVp or above, right? So let's say you're doing portables. You're doing portables on a patient, they're getting ready to try to feed this patient, they put a feeding tube into the patient. What do they usually ask for whenever they drop a feeding tube, as far as x-ray goes?
They just want the end placement.
They just want to know where the placement is. What specifically do they want to see?
Stomach.
They want to see that it's in the stomach and not in the right main stem bronchus, right? So even though they put in a portable KUB, do you shoot a KUB for feeding tube placement? The answer is no. You shoot somewhere between a chest x-ray and a KUB, right? So you might center more like an upright abdomen, as far as where your image receptor is. So let's say you're on the floor, they just dropped this feeding tube into the patient. You don't have a grid on you. You got, a stack of x-rays that you have to complete. Is it worth going all the way to the floor, back to the x-ray department to get a grid, to come back to shoot a KUB, with loose quotations, KUB with a grid for feeding tube placement?
No.
The answer is no. No, absolutely not. The only thing that you're looking for is to make sure that it's preferably below the diaphragm, but definitely out of the right main stem bronchus, right? You want to make sure it's out of the brachial tree, below the diaphragm, and that's good enough. Can you see that without a grid?
Yeah.
On 99% of your patients, yeah. So is it, even though those are rules of thumb, and you're going to break it in two different ways if you're shooting an abdomen for a feeding tube, That is, everybody's abdomen's over 10 centimeters unless you're looking at a pediatric patient. And your KUB, what kind of KVP are you using for KUB? 80, 85, yeah. So you check both of those boxes, but it's just not worth, you know, the extra exposure to the patient. It's not worth the delay in the examination or any of that to go get a grid for it. Excuse me. So I highlighted that for editing. That's not any longer 11.2, that's 22.2. So contrast improvement factor, we talked about that already. That's cleanup. How much contrast do you gain by the use of a grid? So the higher the ratio grid, the better the contrast improvement factor. And it's just a mathematical comparison between you know, the contrast you would expect to see with a grid versus without a grid. So if you have no improvement, then your contrast improvement factor is 1. All right, so going back to the H&D curve, what did we say that a curve that represented a lookup table that was very vertical, what did that tell us?
High contrast.
High contrast, right. So average gradient is that straight line portion of the H&D curve, okay? So the average gradient would be higher, the contrast improvement factor would be higher in the image with a higher ratio grid or addition of a grid. Higher ratio grid, better performance, higher the contrast improvement factor. Okay? So we've talked about this. Bucky factor and grid factor are really the same thing. And it is just how much mass you need to compensate for either the presence of a grid or if we change from one grid or ratio to another. So let's do a little bit more math. So let's say you've got an order for a chest x-ray and you shot the chest x-ray at 85 kVp at, let's say, 2 mass, and the patient has a pleural effusion. Okay, so they say, I want you to go back up to the patient's room and this time use a grid, and the grid that you have is, let's say, a 10-to-1 grid. And, you know, don't look back into the book and look up the Bucky factor. I'm just going to give you a Bucky factor of 4. Okay? So let's say our 10-to-1 grid has a Bucky factor of 4. So you shot the perfect x-ray. The only problem is you had so much scatter radiation coming off that pleural effusion that they couldn't see the air fluid levels well. So they said, okay, go back and do it again with a grid. So you added a 10-to-1 grid with a Bucky factor of 4. What is your new technique?
85 kVp at 8 mass?
Exactly. So it'd just be that times that would be 8 mass, and it should give you the same exposure. So your index number shouldn't change between those two.
Mm-hmm.
Okay. So also though, you may, and I don't think there are any on this test, but just to kind of prep you for the fall semester, there will be these. And that is, let's say, let's change this up just a little bit. And let's say that was a 5-to-1 with a Bucky factor of 2. And they wanted you to go back up and shoot with a 10-to-1 grid with a Bucky factor of 4.
So then you would just, well, it would just be 4 mass, right?
Okay, yes. Tell me how you got there though.
Well, because your grid factor is only doubling, and so you're only going to double your mass.
Right, right. So then what you've got is with a grid ratio, a higher grid ratio, you got more lead, you got more cleanup, it's gonna clean up more scatter radiation, you're gonna need more mass. So as you change your grid ratio from a lower to a higher grid ratio, you're also gonna have to increase your mass. Okay, so you can do this in a couple of different ways. I find the easiest way to do it is that if I've got a Bucky factor of 2, all right, then if I remove that Bucky, or if I remove that grid, what would my mass be without the grid? It'd be 1, right? So without a grid, it'd be 85 kVp at 1 mass without a grid. Okay? So now you're going to introduce a 4 to, or a 10 to 1 ratio grid with a Bucky factor of 4. So then you would just multiply your mass by that Bucky factor, so it'd be 4 mass. Same kVp, 4 mass. Okay? So the higher the grid ratio, the more lead it has, the higher the Bucky factor, the more exposure to the patient, right? The more cleanup it's going to have, so the greater the mass value you're going to need. You all good with that? All right. So then we've got different types of grids. We're going to start with parallel. Parallel is the easiest grid to create. It's the most flexible grid. It does have its drawbacks, but it's the most flexible. It gives you the most positioning latitude. Okay, so with a parallel grid, what you have is that they stand the grid strips on end and then have a interspace material, and then the next one is perfectly parallel to the first one. Okay, so it's just sandwiched in between each one. All right, so that's a parallel grid. The issue with parallel grid is this. All right, so in the middle of your grid, you've got the smallest possible footprint of the grid strip, right? So as I move away from the middle, though, what happens to the appearance of the grid strip?
It gets wider.
Yeah, it gets wider, right? So the problem with a parallel grid is you're always going to have some degree of grid cutoff in the periphery. It might not be perceptible. You might be able to just pick up a little bit of difference in density between the middle and the outer portion, but it's always going to be present. The benefit is that they're cheap to construct, they're easy to construct, they're very versatile. We're going to talk about these two and the lack of versatility in them, but they're very versatile compared to other types, and overall likelihood of getting grid cutoff is lower with parallel than with any other. Okay, so I'm going to pass around a couple of grids to take a look at.
So the likelihood to get grid cutoff is highest with parallel or lowest?
Well, it's always going to be present in the periphery,
Yeah.
but as far as all the way across the image, it's less likely.
Okay.
Okay, so this is what we refer to as a tape-on grid, and I'm going to pass it around in a box, and it's 11 by 13, which is a real strange size. It's an 8-to-1 grid, and it's parallel. So putting that up there like that. And then I'm going to pass around another one, and I'm not going to pass the box around, but you need to look at the label on it, because it's got some very peculiar definitions on it, and this one's bent, it's messed up. So this is a 8-to-1 ratio grid, 103 lines per inch. Recommended focal range is 34 to 44 inches. And it also says tube side on it. Okay, so it's got a lot of very specific and particular instructions on it. So let's kind of compare those two. I got another one up here, but there's nothing really remarkable about it. It's pretty self-explanatory. It kind of latches on, so you know which side is tube side, which side is not. So I'm not gonna pass it around. Okay, so we talked about parallel. Now we're gonna talk about focused, because the second grid that's coming around is what we refer to as a focus grid. A focus grid, the center of the focus grid is just like a parallel grid, okay? So that the lead strips are very vertical for the smallest footprint, but as we move outward, yeah, I didn't mean to do that. As we move outward, and that footprint would increase, the grid strips are tilted towards the X-ray tube. Okay? So this light, the center of the light is the most perpendicular portion of the light, right? This part out here is kind of like the periphery or X-ray beam, and we call that the, starts with a D, divergent X-ray beam, right? So the middle of the X-ray beam is perpendicular to the image receptor, right? But in the periphery, it's really not. It's divergent, and so it kind of, you know, it's at an angle. That's why whenever we do long bones like forearm and tib fib and femur, we might have a difficult time getting the entire anatomy on an image receptor because of the divergence of the central ray. It's kind of like angulation. So with a focused grid, what happens is, again, as the grid strips move out towards the periphery, they start to tilt in to stay parallel to the divergent central ray, so that the grid strip remains very, very small. Okay? So in that second one that's coming around that mentioned the focus, what the focus is the useful distance for that particular grid. Because those grid strips angle at specific angulations, if you get too close, then what happens is that those grid strips are, if your SID is too close, those grid strips are angled out, let's see, not quite as far as what the divergence of the central ray would want them to be. So you see grid cut off in the periphery. If you increase your SID too far, then your central ray is more perpendicular all the way across, and you're also going to have grid cut off, right? Because your grid, the leaning of your grid strips is not consistent with the divergence of the central ray when your SID is too low or too high. So that focal range are the useful densities, or useful distances rather, in SID that you can use that grid. If you get too close, too far away, you get grid cutoff in the periphery. In the middle, you don't see any grid cutoff because, again, it's kind of like a parallel grid.
Yeah, so with focus grid, the main thing is just have like accurate SID.
That's one of the things. We got a lot of different things. So most of the grids that you're going to work with probably going to be focus grid. Okay, so if you look at the grids that you're working with in clinicals, chances are they're going to give you a focal range. Okay, so they're very good at cleaning up scatter radiation, especially not getting that scatter or the grid cut off in the periphery. The problem is not just exceeding that focal range, getting too close, too far away, but also, let's say, let's turn this back off again. Use a different light source. Coming back to you again. Woo! That's bright. All right. That was bad, man. All right. So if you're in the center of your image receptor, the center of the grid, you're centered to the center of the grid, then you've got that parallel relationship, right? But let's say though you're not centered, all right? So if I tell you what, pass the flashlight, I'm gonna hold these still, pass the flashlight, stay focused where you are, but pass the flashlight to your right. What's happening to the grid strips?
You know, bigger.
You're getting bigger, you're getting fatter, right?
So where you put your anatomy matters.
Where you put your anatomy and where you put your central array. So you have to be centered to the center of the to the center of the focus grid. You can angle, with the long axis of either the parallel or the focus grid, but you can't angle across them. In addition, with the focus grid, you have to be centered up to the middle of it, right? Otherwise, you're going to get grid cut off. The other thing, go ahead and hit it again, is that if our grid strips are supposed to parallel our divergent central array, kind of like that, right? And I flip my grid over, then what's going to happen? Big, yeah, big problems. So you're going to have grid cut off immediately. So an inverted grid, where the parallel grid, doesn't matter which way you put it, with a focus grid, if you invert it, then what you're going to have is good density right in the middle, but drastic grid cutoff right outside the middle of the image. Okay, so less positioning latitude, less likelihood that we're going to see any grid lines, but it does come with positioning complications. See if I can just totally mess this up. All right, so that's your focus grid. Has to be within a proper distance. Have to be centered to it laterally, right? Can't be inverted. Otherwise, you're going to get grid cut off. You can't, in any of these, you can't angle against the grid strips. Okay, y'all okay with those two?
Mm-hmm.
Then what we have is a crosshatch, sometimes just referred to as a cross. And what we have in this is two different grids, probably low ratio grids, thin grids, but stacked perpendicular to each other. So in one of these, the grid lines are going this way, and the other one, the grid lines are going in that direction. So with the parallel and the focus grid, you can angle with the long axis of the grid, but you can't angle across it. With the crosshatch, and sometimes you'll even have a focus crosshatch, you can't angle in either direction. The central array has to be perpendicular. All right, so if you have a focused crosshatch, then you have to have not just a perpendicular central array, but it has to be centered to the absolute center of the grid. Otherwise, you're going to have the problem with off-centering in either direction. Okay, so the problems that you have with all grids, universal problems that you're going to have with all grids, are these things. These things. Okay, so if your grid is tilted, regardless of what type of grid you're using, if your grid is tilted, that's what sometimes we'll refer to as off-level. Off-level grid, you're going to have grid cut off all the way across your image. If you have a focus grid and you exceed the focus, you get it either too close or too far away, that's off focus, and you're going to have grid cut off in the periphery. If you have a upside down grid, and this is going to be specific to, or an inverted grid, this is going to be specific to any type of focus grid, then you're going to have very bad grid cutoff almost immediately. You'll have good density right in the middle, and the rest of it, you're just going to have grid cutoff. And then off-center grid, again, if you're looking at a focus grid, if you off-center a little bit, you're going to have some grid cutoff as well. That's not going to be as bad as this. This is not going to be as bad as that either. So tilted grid, just so you know, they refer to it as off level. You're going to have a tendency to think of tilted as being one thing and off level being something totally different. To me, exceeding the focus sounds like a better description of off level, but in this case, what I guess they're talking about is it level to, you know, the perpendicularity of the central ray. So tilted equals off level, equals grid cutoff. Okay. Alright, so just running through those again, parallel, all strips parallel, absorb scatter radiation across the short axis of the image receptor. Simplest to manufacture. You do have grid cutoff in the periphery, you just can't get away from it. And that's because of the divergence of the central ray. And all those strips are not going to be parallel to that divergence. It's worse at low SIDs than what it is at long SIDs. And it does allow angulation with the long axis of the grid. Focused also allows angulation with the long axis of the grid. They're difficult to manufacture though. They're designed to minimize that grid cutoff in the periphery so that you don't have that like what you have in a parallel grid. The grid strips should coincide to the divergent central ray, and that's what they refer to as canting. C-A-N-T-I-N-G, canting. Canting of the grid strips is specific to your focus grids, right? Or possibly the focused crosshatch. So specific SIDs you have to use specific SIDs, otherwise you're gonna have grid cutoff. Has less positioning latitude than parallel, but more positioning latitude than a focused crosshatch. So the crosshatch, usually two parallel grids together with the grid strips perpendicular to each other. Very, very, very good cleanup, but just very low positioning latitude, inherently high dose. So higher contrast improvement factor as well. All right, so any questions on grid types?
Are they all either focused or non-focused?
Fundamentally, yeah. Yeah, because a parallel grid's non-focused, crosshatch that's not focused is, you know, just two parallel grids together.
So you can have a parallel focused or a parallel non-focused?
No. No, the focus is always going to be specific to. Oh, okay. Ask your question again, because I want to make sure I'm not running down a rabbit trail.
Crosshatch can either be focused or non-focused.
Yeah.
Parallel is just parallel.
Just parallel, right?
Okay.
Right. Yeah. Okay, so whenever you make an exposure in the department, you can make a dry exposure and you can listen for the diaphragm to move. But make an exposure, you know, not on a patient, listen, and sometimes you can hear it actually vibrate. So there are different motions that the grid will undergo. Sometimes they reciprocate. What does reciprocation mean? Back and forth, so it just goes back and forth. Sometimes it oscillates. Oscillation is, you know, kind of a round and round motion. So what happens with your moving grid, which you're working with, as long as you're shooting into the bucky, into the table, or into the wall, is that it moves so that the likelihood of being able to visualize those grid strips decreases. All right, so it's kind of the same principle as using the wagging jaw, right? So the Otnello method, if we can't see the upper C-spine, you have the patient move their jaw like they're chewing, and it blurs out the jaw. It's kind of the same thing. If we move the grid, then it blurs out the grid lines, and even on high resolution image receptors, you just can't see the grid lines. So the different motions, again, would be reciprocation, oscillation. Potential problems would be if there's mechanical failure. Now you're there with a stationary grid, and potentially you can see the grid lines again. Again, the grid lines are going to be so small that they're probably not going to interfere with much. So be it a problem or not, you know, I don't know. The other thing is that it does increase OID. So, you know, there is always an increase in OID if you're shooting into the table bucky. You've got the tabletop, you got the detectors, you got the grid, and then you've got the image receptor. So you've always got about 3-inch OID increase. So part of that is because of the grid and the mechanism to move the grid. Also, too, if the image receptor isn't secured in place really, really well, then sometimes that little bit of motion that is going on with the grid can introduce motion onto the image. So generally we think of motion as being a patient issue, and it most of the time is, but there can be motion caused by the equipment, and this would be a case of that. Personally, I've never seen this, and I've worked with some machines where the oscillation was quite dramatic. You could see it, you could hear it, you could feel it in the table, but you couldn't see it on the image.
So how would you ask us about moving grid on, would it just be like a definition, like what is this?
Yeah, so maybe a number of things. So what's the purpose for moving the grid?
To make sure not to see the lead strips?
Right, blur the grid lines. So that would be one. If you have mechanical failure, then potentially you would see
The grid lines.
grid lines. Right, exactly.
Okay.
Off level, we'll take a look at all of that. All right, so grid selection, what are you doing with the grid? You know, what kind of patient, you know, what kind of equipment are you using? Are you using portable? Are you using, you know, you're shooting patient in the department? Our grids, in most of our machines now, we can remove the grid. So our general rules of thumb, again, 70 kVp, shoulder size, knee size or above. What if you have, let's say, a 10-year-old knee that you don't really have a good technique for, so you want a phototype? Does that 10-year-old necessarily need a grid? My granddaughter, her legs are like this bad. She's tiny,
No.
right? So do you need a grid for that?
No, you wouldn't want to up the dose.
You wouldn't want to increase the dose because it's a kid, right? You don't need it because you're not at 10 centimeters or above. You could use 65 kVp. You could remove the grid and just shoot directly into the, directly into the image receptor. So, grid selection. What is it you're doing? What kind of equipment are you using? Are you in the department? Are you using portables? Do you actually need a grid? How high ratio grid do you need? You know, 8-to-1 is usually okay for exposures below 90 kVp, but once you get to 90 kVp, you have so much penetrated scatter radiation, you're probably going to need a higher ratio grid. Most of your grids, most likely, are going to be 10-to-1 focused. So when you go into clinicals, you know, if you're looking at a snap-on type grid, take a look at all the features of it. Chances are it's going to tell you tube side. That alone is going to tell you is what type of grid. It's focused, right? So it's going to give you a range of distances, which is again going to tell you it's focused grid, right? And it should tell you the grid ratio. So if you're shooting above 90 kVp, you probably need something higher than that. Unfortunately, the patient dose is going to go up dramatically, typically 3 to 4 times. We have different applications, different types of grids and grid ratios for things like mammo versus diagnostics. So, air gap is worth mentioning. So air gap is probably not as dramatic as what we make it out to be. So with the air gap, the science behind it's good, but I think that the contrast improvement factor that we might see because of air gap is, even with screens and films, just not all that impressive. So with the air gap technique, what you've got is a increase increase in OID, let's say we're shooting a lateral C-spine, we have an increase in OID, so the penetrated X-ray photons are still gonna hit the image receptor, right? The ones that don't interact with anything, they're still gonna hit the image receptor, right?
Mm-hmm.
But what about wide angle scatter radiation?
I'm gonna miss it.
You're gonna miss it, right? So it works kind of like a low ratio grid in that not all of the scatter radiation is gonna make it to the image receptor because they increase in OID. So, contrast improvement factor for air gap technique is really pretty low. Again, the main thing that's gonna draw out your contrast on your image is gonna be your computer algorithm. So you can try this in clinicals. I would suspect that you're not gonna see a whole lot of change, but you can mock up a patient, shoot not using a grid, you know, with an increase in OID, and then shoot a second one using a grid and see if you can visualize much of a difference. My guess would be that you're not gonna see all that much of a difference, but that's there. Okay, so other ways to manipulate, you know, if you're changing from a low ratio to a high ratio grid, your new mass is equal to old mass times the grid that you're going to divided by the grid that you're coming from. To me, it was always easier just to break it down to what would this technique look like if I wasn't using a grid at all, and then reintroduce the other grid. So you can work it out this way if you prefer to. Okay.
So that word problem, would that be something you would ask?
Yeah.
Yeah. So on that one, would you use like 15% rule?
No. On this, what you would do is, let's say we got a pediatric patient who needs a KUB, requires measures with thickness that would call for a KVP 36 mass, 8:1 grid. But it's a pediatric patient. We want to use lower dose, so how would we accomplish that?
You lower your grid.
You lower your grid. So you could use a 15% rule to, you know, increase KVP or reduce mass. Okay, but in this case, it's asking for grid.
Mm-hmm.
So we want to use a lower ratio grid. So we went from an 8:1 grid to a 5:1 grid. So naturally, our technique, since we have less lead, our technique needs to be higher or lower? Lower, right. So our new mass would be 36 times 2 divided by 3, and that would give us 24 mass.
Mm-hmm.
So our new mass with a 5:1 instead of the 8:1 grid would be 24 instead of 32.
Mm-hmm.
So we save some patient dose. So you can do it like this, or you know, again, you can just remove the grid from the equation and then reintroduce it. Okay? So there's one other thing that we need to talk about, and that is virtual grids. So virtual grids, where is virtual grid? It's on page 305. So virtual grids, I think, are going to be, I think eventually physical grids will go away when we use virtual grids almost exclusively. So what a virtual grid is a complete absence of grid. So what you have in your image detectors in DR is the ability to not just count the X-ray photons, which is all screens of films and CR technology did, but it can detect what energy level that X-ray photon was. Okay, so what do we know about scatter radiation? Post-patient versus pre-patient, what's the energy level of the scatter radiation? It's lower, right. So it's lower. So what virtual grid does is it measures not just the X-rays that come through, but the energy level of the X-rays. Can't really measure the angulation all that well, but it can measure the energy level. So if you set a technique of I don't know, 100 kVp, let's say you shoot a chest x-ray, 110 kVp, then it knows that off that 110 kVp x-ray beam, you should have a lot of high energy photons coming through the patient, right? So not many 10 kVp photons should be striking the image receptor. So if it measures, that level, then it disregards it. It says, okay, that's too low, that has to be scatter radiation. 10 kVp, that lower end of the brim spectrum should have absorbed inside of the patient. If this came through the patient, it's scatter radiation. So it just disregards it. So it does take the number of photons, and it reduces the number of photons in the calculation of your index number, which means that you have to drive up your mass still. But the difference between a virtual grid and, let's say, a 10-to-1 grid is dramatic. Okay, so for a 10-to-1 grid, we used a Bucky factor of earlier 4, right? Which cost the patient dose how much? 4 times the patient dose, right? With a virtual grid, the dose is still going to go up, but it's only going to go up by a factor 2. Okay, so I think as they dial in the effectiveness of the virtual grid and further dial in the lookup tables to ferret out that contrast, I think 2 things are going to happen. I think we're going to start to see KVP being our factor of choice for adjustment and patient thickness and tissue type and all that kind of stuff. And I also expect physical grids to go away. Because in both of those cases, what we can do is we can cut back on the patient dose and keep our dose as low as reasonable. Very good. Okay. I think that's about all I've got. Any questions?